Good evening. I'm Sarah Jo Best with Lincoln Trail District Health Department. As of press time today, there are a total of 99 cases of COVID-19 within the Lincoln Trail District service area. The total number of cases are as follows: Hardin 39, LaRue 5, Marion 16, Meade 12, Nelson 22, and Washington 5. Currently, 90 cases are on home isolation or have been released for monitoring. County-level data can be found at our website at ltdhd.org. The governor has outlined guidelines for a phased and gradual reopening of the economy in Kentucky. The key words that he stresses when talking about the plan are safe and smart. On April 27th, Healthcare Services initiated the first step of the phased approach outlined in the governor's Healthy at Work initiative. Beginning with healthcare serves two purposes. As the state's economy is slowly restarted, healthcare facilities have time to build medical resources and are better prepared to deal with any spike in COVID-19 cases. It also allows leaders to get a glimpse of how citizens will respond to the strict measures needed to open additional businesses. Contingent on what is seen in healthcare, a broader reopening of Phase 1 will continue in May. This could allow certain parts of the business sector to open their doors. However, all phases are subject to rollback or delay should the state see a new surge in COVID-19 cases. Businesses permitted to open in May must ensure that certain health and safety measures are met. Companies will not be able to resume pre-COVID-19 operations. Plans and processes must comply with state and public health officials' requirements to minimize the spread of COVID-19 within their facilities. Now is the time for business to begin to think about these processes and plans and how they will resume operations in a manner that protects workers and customers. One of the most important factors a business should consider in reopening their facility is keeping people at least 6 feet apart. This may mean eliminating areas where employees or customers can gather, for example, removing tables in employee break rooms, staggering times when employees clock in, or getting rid of waiting areas for customers. Organizations will also be responsible for obtaining their own personal protective equipment, or PPE, and cleaning supplies prior to opening. If unable to do so, then that facility must delay opening until adequate supplies can be acquired. Staff and patrons will be required to don masks and have their temperatures taken before entering the building. Employees are still encouraged to work from home whenever possible to minimize the number of people in the building at any given time. Employers should also consider how they will handle employees who are symptomatic for COVID-19. Many of our county residents may be wondering how this phased and gradual approach will impact their ability to return to normal as well. Residents must keep in mind that reopening additional services will depend on a COVID-19 timeline, not a specific date. Until a vaccine or medical treatment is available to defeat this virus, we need to be prepared for a new version of normal. One example is the need for masks. According to Governor Beshear, in businesses allowed to be operational, employees must wear masks. This directive will apply to the general public as well. Any individual who must leave their home for work, medical supplies, or medical care must now include a face mask as part of their standard wardrobe. Healthy at Home will continue to be part of Kentucky's new routine in the months to come. This simple practice will save countless lives. It will ensure we are doing all we can to protect those at highest risk from suffering severe complications from COVID-19, such as our senior adults and people who have serious underlying medical conditions. I understand that this is confusing and it changes all the time. It seems like what guidelines are valid today are not tomorrow. I ask that you remember this. This is new. We're learning. And as it spreads and more people get the disease, we learn more. We try to use this knowledge to provide guidance to you on how you can protect yourselves, your loved ones, and those in your community. This has been a tough time for all of us and has required us to be patient, to alter the way we do things, and to give up things we love. I'm asking you to stay the course and be thoughtful in how we reopen our communities. For more information regarding dates and details, visit KentuckyKYCovid19.ky.gov.